This way. Sir, this is my self-introduction speech. No, I'm sorry. This is my informative speech, actually. This speech is to inform you about sleep apnea. The reason why I chose to do this speech is because I worked as a sleep technician for 7 years, and a lot of people are not aware of sleep apnea. So what I first do when patients come to a sleep lab is inform them of the dangers of sleep apnea and why it's important to be diagnosed and be treated for sleep apnea. So some of the things that you're going to want to pay attention to are some of the symptoms for sleep apnea. Sleep apnea is the absence of breath when you're asleep at night. So there's a cessation of breathing for a number of reasons. Either you have an obstructive sleep apneic event, which is something is blocking the airway between your upper airway, your mouth, your nose, or your throat. Or you have central sleep apnea, where there is your brain and your body are not communicating. So when you're asleep at night, when you stop breathing, your brain does not tell your body to resume breathing like it normally would. And then there is mixed sleep apnea, which is a combination of the two. It's obstructive and it is also central sleep apnea. You'll see a combination of both when the patient is asleep. So some of the things that some of the things that you're going to want to look for and pay attention to is excessive daytime sleepiness. And what that is basically being tired throughout the day, having a full 8 hours of sleep, and then still not feeling rested when you wake up in the morning. So a lot of patients will go in just for feeling sleepy, and then their doctor will say, well, let me take you and have you have a sleep study done, and then we can find out what's going on. And so then when you come and see us, what we would do is we would set you up to our equipment. We look at more than just your breathing. We're going to look at your brainwave activities, because we want to know what stage of sleep you're going into, how long you're in each stage of sleep. You're making sure that your sleep is correct, that you're not having seizures, that there's no interruptions, that things are going the way that they should be. Also, they're going to ask you, do you snore? Because it could be normal, but then again, it could not be. And sometimes that vibration can cause sort of like a callus and can cause problems later on in the future, just like a simple snore. So you want to find out and make sure that everything is just a normal thing with that, but it can progress into something else. There are other things that can progress, such as heart disease, high blood pressure. All these things are because when you're not breathing and your oxygen is blocked and your blood and the oxygen is not circulating through your body correctly, then it causes, but you have headaches. These are just the short-term symptoms. It can cause for you to have headaches. It can cause for you to have problems with your short-term memory, irritability, lack of interest in things that you normally do. So a lot of people become very frustrated. A lot of people are not able to function on their job and are just really angry by the time they come to the lab and want to get things figured out of why they're not sleeping well and what's going on with their breathing, but they may not correlate the two together with the breathing and the actual sleeping at night. They just think that for some reason that they don't sleep well. So this speech basically is to let people know the dangers of sleep apnea. If it's not treated, it does progress into things like high blood pressure. It does make it hard for you to gain or to lose weight or maintain your weight, and it has long-term effects. And if you stop breathing too long, of course, you can have brain damage. You could die. You cannot wake up from that. It's something that can be potentially serious and fatal. So it's something that if you have a problem with, or someone that has a problem with it, they should check out. So if you see someone who has a pretty big midsection, they snore, they're always tired, that's something that you may want to have them check out. Thank you.